Namaskar. Welcome to Diet and Kidney Academy. We are going to discuss about chronic kidney disease today. This is Dr. Suneeti Khandekar. I am an MBBS clinical nutritionist, MBA hospital administration, and course director at Diet and Kidney Academy. We have Renal Nutrition Basics 2.0 running. We have Renal Nutrition Advanced, and we have complete Indian Renal Nutrition. I am on a mission to help Indian nutritionists, dietitians, and doctors learn Indian renal nutrition with Indian diet perspective. So let's begin the topic chronic kidney disease. This is Suneeti's Diet and Kidney Academy where we learn, help and achieve, and it's a complete solution to the quest for Indian renal nutrition. Now let us begin our topic with something as basic as functions of our kidneys. Now kidneys have three functions: excretory function, synthetic function, and regulatory function. All we know is kidneys throw waste products and urine from our bodies. But let us discuss these three different functions into step by step. So, excretory functions: throwing wastes like urea, creatinine, excess potassium, and acids from our body, especially our blood, by removing excess water and by excreting drugs and toxins. Now, the synthetic functions of our kidneys are making erythropoietin, that is EPO, for RBCs. Now, this erythropoietin helps in the formation of hemoglobin. The second is vitamin D formation for calcium absorption and bone health. And the third synthetic function of our kidneys, one of the most important functions, is in gluconeogenesis. That is during starvation, when there is no food available, when the blood glucose levels go down, then gluconeogenesis is a process through which the proteins and fats are converted into glucose and our body glucose is maintained. The regulatory functions of our kidneys are: it regulates the blood pressure, it regulates the blood volume via sodium absorption or excretion. Now, what happens when kidneys fail? Now, on the left side of this diagram, you can see that there is increase in urea, creatinine, blood pressure, there is increase in water retention, and there is swelling. What decreases is the erythropoietin or the EPO, that is the synthetic function of the kidney. Now, since the erythropoietin is low, the hemoglobin also decreases and the vitamin D synthesis is reduced, so vitamin D is reduced. Now, the stages of kidney disease, that is chronic kidney disease, based on GFR, that is glomerular filtration rate, the National Kidney Foundation has divided CKD into 5 stages. You can see on the left side of the diagram, stage 1 is where the GFR is more than 90 with structural or biochemical abnormalities. Stage 2 between 60 to 89. Stage 3 30 to 59. Stage 4 15 to 29. And stage 5 less than 15 milliliter per minute of kidney functions, that is glomerular filtration rate. Now, the structural or functional abnormality of the kidneys lasting for more than 3 months is called chronic kidney disease. The structural abnormalities include that the kidneys may be small in size. There could be just one kidney by birth. The kidneys may be horseshoe shaped. There could be obstruction to the collecting system, that is the anatomical abnormality or the structural abnormality of the kidneys. The functional abnormalities include excessive protein loss in urine, elevated creatinine in the blood, and many more. Now, creatinine level in the blood is a specific marker of kidney functions. Creatinine is released from the skeletal muscles and therefore its value in blood is higher in those who have larger muscle mass. Creatinine is normally thrown out by the kidneys through urine. When kidneys are working abnormally low, this creatinine level increases in the blood. And that is how we get to know, because it's a very sensitive marker. On repeated blood checks, when this rise remains sustained for at least 3 months, the person is said to have chronic kidney disease. Now, normal values for men are between 0.7 to 1.1 milligram per deciliter, and creatinine values for women are 0.6 to 0.9 milligram per deciliter. These values vary from lab to lab, and the same sample tested in two different labs will often give significantly different values. So follow one standard lab. Now, symptoms of chronic kidney disease do not appear till 90% of the kidney function is lost. Imagine that. And therefore, screening of individuals at risk is of utmost importance, because we never know that the kidneys in our body may already be giving up, and we do not want them to reach 90% less of their kidney functions before we come to the conclusion that CKD is there. Now, if the kidney sizes on sonography are small, that is less than 9 centimeters, that almost confirms the diagnosis of CKD, but it has to be correlated clinically. Now, causes of kidney failure. What are the different causes? Uncontrolled diabetes, uncontrolled spikes of blood sugars, chronic kidney disease of unknown origin, late diagnosis of these, frequent urinary tract infections, even in males or females, doesn't matter, infections in the upper urinary tract, high blood pressures which are uncontrolled, so the spikes of blood pressure because of stress, anxiety, excitement, anger may cause kidney failure. Glomerulonephritis, the filters in the kidneys get damaged. Kidney stones, if bilateral obstruction, that both the kidneys have got stones in it and there is obstruction on both the sides, it may cause kidney failure. Or polycystic kidney disease, which is a hereditary kidney disease. Risk factors: long-standing diabetes with spikes of blood sugars, high blood sugars, hypertension, spikes of high blood pressures, obesity, family history of kidney disease, smoking, old age, protein loss in urine, and autoimmune diseases like lupus are the risk factors for chronic kidney disease. Now, causes of chronic kidney disease in a nutshell: diabetes, hypertension, CKD of unknown origin, non-tested alternative medications with heavy metals, and excessive use of painkiller medications which are sold or which are bought across the counter, over the counter, just for small reasons as dental pain or arthritic pain and all, may be the reason of causing chronic kidney disease if there is long-term abuse, that is abuse, excess use. Now, the symptoms of chronic kidney disease. Remember, the symptoms do not arise till late stages of CKD. Hence, commonly CKD gets diagnosed at stage 4 or 5. What are the symptoms? You feel easily fatigued. There is generalized weakness. You don't feel like getting up. There is reduced appetite. There is nausea. There is reduced urine output. There is swelling over feet. There is breathlessness at rest or after exertion. All these may be the symptoms of CKD. Get your kidney function tests, which is a simple blood test and a simple urine test done in a standardized laboratory. Now, complications of CKD. Most patients do not have symptoms until the kidney functions are moderately to severely impaired. We have seen that more than 90% of the kidneys functions go down and then there are symptoms. So even they make normal or near normal amount of urine till that time, but it does not contain sufficient amounts of body's waste products. There could be edema in these patients, that is swelling of feet, ankles or on legs, loss of appetite, increased sleepiness, nausea, vomiting, confusion and diffused thinking, high blood pressure, anemia, high potassium levels, dangerous for the heart, bone disease can happen. Uremia is a group of symptoms which include loss of appetite, nausea and vomiting. Fluid around the heart may happen. There would be confusion. dizziness, drowsiness, changes in mental status, and even coma. How do we evaluate this? Just by doing kidney function tests. eGFR is calculated, blood urea and serum creatinine needs to be checked. In urine test, check for presence of albumin or protein in urine. And the third step would be imaging, ultrasound or CT scans to check for blockages in the urinary tract, either due to kidney stones or some anatomical abnormalities or large cysts in case of polycystic kidney disease. That's how you evaluate chronic kidney disease. Now, dietary aspect is an essential aspect of chronic kidney disease management, wherein the recommended dietary education should have these following steps: assessment, goal setting, monitoring, and follow-up. And you learn about these dietary recommendations and how to give Indian diets to Indian patients all across the globe with Renal Nutrition Basics 2.0 program by chronic kidney disease patients. This program is chalked out by Diet and Kidney Academy, a complete solution to the quest for Indian renal nutrition. It's a lifelong access program wherein you get to learn about each and every aspect of Indian renal nutrition as far as chronic kidney disease and kidney stones or nephrotic and everything related to kidney problems is concerned. So medicines, diet and exercise are key to quality of life in CKD, wherein home food, which is well cooked, clean, hygienic, healthy, nutritious, and as advised by renal nutritionist, is recommended for our patients of chronic kidney disease. How to take care of our kidneys? Blood pressure control. This is the 7-point strategy to protect our kidneys. How do we do that? Blood pressure control, sugar control, weight control, infection control, stress control, malnutrition prevention, and lifestyle modifications. And you get to learn about all these for our Indian patients at Diet and Kidney Academy's Renal Nutrition Basics 2.0. Join our program. The link is given below. Dietary interventions in chronic kidney disease. There should be salt restriction to help control blood pressure. There should be protein in the diet, and restricting protein to 0.6 grams per kilogram body weight may help delay the progression of CKD. But in Indian diets, reaching 0.6 is also difficult. So restricting protein for Indian patients is not the way to go. Potassium restricted diet with low potassium foods and leaching of vegetables, pulses and dals. How do we do that? Learn in Renal Nutrition Basics by Diet and Kidney Academy. Phosphate. In early CKD, body retains phosphate. As it progresses, the phosphate levels go up. Dietary phosphate restrictions are recommended. Cholesterol and triglycerides. High triglycerides are associated with increased risk of chronic kidney disease and cardiovascular disease. Dietary changes, strict sugar control in diabetes, smoking cessation, and medications need to be used. Now, Diet and Kidney Academy says that change the way you practice your nutrition. Become an expert in renal nutrition by becoming a renal nutrition consultant. Join our courses. Visit dietandkidney.com for Renal Nutrition Basics 2.0. These are our courses. A complete solution to the quest for Indian renal nutrition. Eligibility is Nutritionists, Dietitians and Doctors. You can write to us at academy@dietandkidney.com for details. Or join our WhatsApp group. The link is given in the description below. Think Indian, my dear friends. Namaskar.